It helps to regulate and it helps to correct cell dysfunction, and it also helps to normalize cell communications inside and outside the cell. And as we all know, all sickness, irregardless whether it could be your headache or whether it could be your gout right at your tip of your toes, it is also coming from the smallest part of our body, which is the cell.
Okay, including serious illness like cancer and...
It's all cell problem. Okay. It's all cellular problem, Heidi. Thank you.
So what kind of disease we can treat?
Living in the city now, we have a lot of degenerative diseases,
Right.
Like for example, Parkinson's disease, Alzheimer's, or even stroke-related condition. In the hospitals, we are at a pain, and we're not able to really help these sufferers, these patients, these people. It is because we do not have an effective method of going in, repairing the cells, and then helping or telling the cells to perform as they should when they are healthy.
Okay, now I understand. So modern degenerative disease are met with positive results.
If the patient are patients enough, yes, because it's just like, for example, in Hong Kong we have the yearly Standard Chartered Banks Marathon. If you want to go and run in the marathon, and if you start training once a week now, or once a month, okay, or you train every day, which Heidi would you think can do better? The one that trains every day, or the one that trains once a month, or just once a week?
I got it.
Okay, so yes, every single of our degenerative conditions patient do have positive results, and I meant every one of them. Not like our normal Western medical protocols that out of 100 if we get 30, we're very, very lucky. But here, no. Out of 100, we have 100 cases that are positively met with.
Oh, that's great. So how long will one see any improvement by using this machine?
Well, Heidi, because we are not using chemicals, medications, what we call drugs, to interfere with the natural or the normal functions, okay? And also we are not just masking.
Right.
Usually most drugs usually just cover up the symptoms. Most of them will not go and help or eradicate the cause, okay? So having said that, Heidi, the ESC goes right inside to each and every of our cells, and then it helps to correct through the electrical, very minute electrical current that goes into the cell. So when the medical device ESC is being applied, the current goes through every part of the body and it penetrates every single cell. It helps to regulate the inside function of the cells. It regulates the cell membrane, the outer covering of the cells. The cell will then be able to perform very normally. And you see results in a very short period of time. But if we have people telling EMT that, oh, I'm very busy, I do not have the time, I can only come once a week, or I can only come once a month, I can only use the device at home once a day or once a week, then it takes a longer time, a much longer time for you to see positive results.
That makes a lot of sense. Doctor, my mother has always been suffering from sleeping problem, and sometimes she's having a hard time getting to sleep. So can this machine actually help her with the problem or just relieve the symptoms?
Sleep problem happens very commonly in the older population. It could be due to the reason that the brain is not functioning so well because it's not receiving enough raw materials, it's not receiving enough oxygen, it's not performing well. Okay, so it cannot make the sleep hormone that it's supposed to make when you are supposed to sleep. So you have sleeping problem. We all know that our body's requirement, oxygen or food, that we call nutrients, are delivered only by one system, that is our blood. Usually, when we will tell the seniors to go do some exercise, it actually helps depending on how you set your medical device. It actually helps to speed up when you're using the medical device to speed up your blood circulation to a very high level, equivalent to you walking 10 kilometers, which is about 10,000 steps in 20 minutes. Or if you go on the higher settings, your blood circulation could be equivalent to you running 10,000 steps in 20 minutes, which is highly improbable and impractical, even for the Ironman. So the ESC, oleous systemic cure, is able to do that. That's why it's able to send blood to your brain. It's able to open up blocked blood vessels, and it's also able to help your nerve circulation, your lymphatic circulation, besides your blood circulation, and most important of all, TCM. In TCM, the Chinese medical professionals always tells us that if our meridian channels are blocked, then we will develop certain health conditions. ESC, this medical device, is able to help to unblock our meridians. That's why it's able to help in many conditions, as well as in the very difficult degenerative or senior population's illnesses.
Is this treatment suitable for everyone?
Yes, Heidi. Well, because every one of us, even animals, has cells, even plant has cells, and we all are dependent on how our cells functions and perform, and our health is actually indication of how the cells in our body performs. Okay. Every one of us at one time or the other will have some kind of problems. As a rule of thumb, as long as the child can walk and run, okay, as long as the senior are not dead yet, they could be in a coma, or they could be paralyzed. All right. It is safe to say that this device is suitable for the young and old, for everyone, not just for applications in disease condition. You can also use this as a prevention, but also you can use this as a health maintenance, which is the most difficult, to maintain health.
So what is this treatment all about?
Well, Heidi, we are in a new era of medicine now, as far as I think and I'm concerned, that the public is very well informed. They all know that if they can prevent, if they can avoid side effects, they would want to avoid all side effects. Okay, so this treatment is all about green technology, using non-invasive. That means we do not put a needle into your body like acupuncture. So we call this acupuncture without needle. In ICU, in intensive care unit, in very sick patients, we will monitor their heart and we will monitor their brain. And when there is no heartbeat, when there's no brain wave, we can certify them dead. These are all actually electricity or electric current produced by our brain cells or by our heart cells. And these are called biocurrents. And the device actually uses industrial current at very specific waveforms and intensities. When it goes into the cell and when it regulates the inside function of the cell, correct, normal, healthy biocurrent will be generated by those cells. And these biocurrent are used to regulate the channels or the doors that are on the cell membrane, on the cell skin, cell covering, and they are also used as communication messages between cells. The ESC does not cure specific illnesses. It just, the current is sent into your body through the various contact points I've said. There are many drugs now that are very specific, targeting Parkinson's as well as autistic children. However, what this device is able to do is to go to the root cause of the problem, which is the cell, and correct cell function. That's why EMT has great successes with central nervous system disorder like autism, like ADHD, as well as the most difficult Alzheimer's and Parkinson's.
So how about some common degenerative conditions like high cholesterol, high blood pressure, and diabetic conditions?
Well, Heidi, we know that these are all lifestyle mediated. However, we also know that any conditions could be genetic, could be hereditary, could be congenital. But it still boils down to cell functions and cell performances. And I touched upon on the earlier question how EMT is able to regulate and help the brain cells to perform better. Okay, now our brain, which is our central nervous system, is actually the main control center or the main instructor of our body. High blood pressure doesn't mean that it is only your blood vessels or your heart conditions. High sugar, diabetes doesn't mean that you only have high blood sugar. No, our body are all bounded together, okay, and every system helps another system. So if one system is not working well, don't you think other systems are also affected? It is only natural. But because of the years in medical practices, when you have pain, we give you painkillers, okay? When you have heart problem, we give you heart medication. We have made and given this impression that the body is functioning
Separately.
which is a very, very misleading and bad impression. Traditional Chinese medicine philosophy, 5,000 years
Right.
old, PCM doctor saying that your eye's not good, maybe it's your liver, maybe it's your kidney, or maybe it's your heart, you know. Philosophies tells us that our body works as a whole. Okay, so either your high blood pressure, high cholesterol, or high blood sugar condition, it still boils down to your cell not performing well. It still also will affect your brain. High blood pressure could be a condition. Well, for the old people, we know that it's because of the hardening of the blood vessels. All right, and blood vessels are also made up of cells. That is one very simple condition for high blood pressure, besides your hormonal imbalances, besides other conditions. Okay. Now, coming to high cholesterol. High cholesterol is one condition whereby you have high blood fats in your blood circulating. And when you have increased circulation at a very, very high speed, you are also burning off the blood in your fat. Diabetic conditions could be that you are born with it. That means that your pancreas is not making insulin. Okay, we call this type 1, whereby we have to give insulin through injections through very young children. Okay, this is because the pancreas is not well formed, it's not working well. Or type 2 diabetes condition is you have insulin. You have enough insulin, but your insulin is not penetrating, your insulin is not going into your cell. It could be due to maybe the quality of insulin is not that good, or it could be the channel, the door, the gates on your cell walls are not functioning so well. Okay, and all these conditions are actually regulated by this Aurelia systemic curer. Now, Aurelia is the name of this medical device, and I've mentioned that this is a medical device, and yes, it's made in Japan. This is an international medical device that is able to help patients or the acupuncturist Chinese doctor to perform acupuncture without needle, and it's able to help correct the cells performances without giving you medication. So this is truly a green, a truly a non-invasive, a truly environmentally friendly, humanly body and human psychological, because we are all afraid of the needles.
Yeah, me too.
We are all afraid of needles. Okay? So this is a very, very green, environmentally friendly device.
So how about those been sick for a really long time, or those been suffering from incurable diseases? Can this device help?
Yes, Heidi, definitely ESC Aurelia systemic curer and the treatment protocol, the treatment method and the application developed by EMT is able to treat them. But unlike conventional Western medication where you have a headache, you take a painkiller, it goes off in 20 minutes or 10 minutes. With the protocol here and with this device, you are able, well, albeit you need time. So it takes time, but at least here in EMT, they offer light at the end of the tunnel. They could have been sick for 5, 10, 15, 30 years. Now, EMT offers a ray of hope. And this is the light at the end of the tunnel for them. Because of the different different cells maturity level in our body, anything, it could be like 80 days to 150 days, right? So we use a medium of like 90 days, 3 months to 4 months, and every treatment cycle is actually 3 months. Over the last 8 years, we see vast improvement in 3 months. Some of this are due to the diligence, the patience of the subject or the sufferers, but regardless whether it's children autism, whether it's ADHD, which is attention deficit, or whether it's Parkinson's, or Alzheimer's, or stroke patients, we normally see improvements, vast improvements in every 3 months cycle. To put your time in for this 3 months, you will definitely see results.
So the device can help the cell to grow. So how about cancer cell? Will it make it even worse?
Well, Heidi, cancer are also cells,
Yes.
but cancer cells perform very differently, live very differently, and the requirements are entirely opposite that of healthy cells. Healthy cells require oxygen and nutrients to function normally and healthily. Cancer cells does not require oxygen. There's a very well-known German scientist, medical doctor by the name of Dr. Otto Warburg. And this Nobel Prize was for his thesis about normal cells developing or changing into cancer cells. If you reduce just 25% of oxygen or biochemical, which is nutrients, supply to healthy cells, then healthy cells will become cancerous. So, ESC, when you use it or when the treatment is being carried out, actually enhances oxygenation of the blood. It improves nutrient delivery to the cell and to the organs. When these are achieved, when these goals are achieved, you are actually suffocating cancerous cells.
So now I understand that most of our body's problem is because of the malfunction of our cells. So this device can actually help correct and repair those cells so that our problem can be improved.
That's right, Heidi. Very true, very correct.